Hello, and welcome to Lab 5, which is Chapter 8 in your textbook. This is the appendicular skeleton. The appendicular skeleton includes your arms, your legs, and everything that holds your arms and your legs to your trunk. So we're going to start with the upper extremities, or your arms, and we'll look at the parts or the bones and the parts of the bones that help hold your arms to your trunk specifically. So we have our clavicle, we have our scapula. These are the two bones that help to hold your arm, which that first bone is that humerus, to your trunk. These, the clavicle and the scapula, are what make up this pectoral girdle. These are the two bones. So our clavicle. Our clavicle has a sternal end to it. The sternal end is it's more flat, vertical. Up and down, you can see this flat edge this way. Here, you can kind of see it from this view here. Sternal end. So this is the side that comes in contact with the sternum down here. That is the sternal end of that clavicle. Our other side is the acromial end. That acromial end comes in contact with that scapula. This part, it's hard to see from this view, but this is more flat in that horizontal plane. That's one way, if you're looking at the actual bone, to be able to tell the difference between the two ends, is the sternal end is more flat vertically. The acromial end is flat horizontally. Our next bone that makes up this pectoral girdle is the scapula. On our scapula, this medial border, this is the medial border because this is the side that's going to face the spine. The spine is in the middle. It's towards that medial side. That's what makes it that medial border per se. Then we have an inferior angle, a superior angle, a superior border, and a lateral border. So that superior angle is that point at the top, inferior angle is that point at the bottom. Our superior border is this flat part here. Here's that medial border and that lateral border of the scapula. In the top portion of the scapula, we have this suprascapular notch. This suprascapular notch is made up of this little area that comes down through here. In that area, there's nerves and blood supply that are going to travel in the suprascapular notch. And since there's something that travels through it, it gets a name. And on all of our bones, if something attaches to it, if something travels through that little area, it's gonna have a name. We have this acromion across the top here. You can kind of see this point that comes around. I'll show it to you from the other side. You'll understand where this acromion is coming from. We have this coracoid process, which is this part that comes along here. That is that coracoid process. Then we have this glenoid cavity. This glenoid cavity here, it's this little divot through here. This glenoid cavity is where your arm, that humerus, that top bone of your arm, comes in contact with that scapula. This is where they both come together. The last thing on this slide is this subscapular fossa. This whole area is the side that faces the rib cage. There's a muscle that sits in that area that's called subscapularis. So, and that muscle attaches in that subscapular fossa. That's why it has a name. The names will match the muscle sometimes, and this one, it does. So this whole area is the flat side of the scapula is the side that faces that rib cage. I said that because if we look at the back side, this is the side that faces away from the rib cage. We still have that superior angle, superior border, that medial border, that lateral border, that inferior angle. I showed all of those. Here's something different. This spine. The spine is this projection that comes off. So this whole part that comes off here, it sticks out pretty far too on the scapula. This is the spine of the scapula. I told you I was going to show you the acromion. That acromion is kind of that continuation of that spine that curves around towards the front. That is that acromion. This is actually the part of the scapula that comes in contact with that acromial end of that clavicle. So that clavicle, shoulder blade, or the collarbone, that's that clavicle, comes in contact with this scapula at this acromion. So right through here. Something else that we have on this side that we don't have on the other side. We have this supraspinous fossa. Supra means above, spinous, so above the spine. So this is this area that sits above that spine of that scapula. Then we have this infraspinous fossa. Again, it tells us infra, it's below spine, spinous, infraspinous, below the spine, and it's a fossa. It's a little kind of indentation divot through here. That is that infraspinous fossa. There's muscles that sit in there too. You'll learn them when we get to the muscle chapter, but that supraspinous fossa has supraspinatus. That infraspinous fossa has that infraspinatus muscles. So learning these will help you learn muscles later on because these muscles names match where they sit. Then this glenoid cavity. This glenoid cavity here, this is this round circular portion. You see it here. You can see part of it down here at the bottom. But this is where that humerus, that upper arm bone, is going to come in contact with that scapula specifically. You can still see that coracoid process here that is coming around here. It's coming up and over here. That's that coracoid process, and we still see that suprascapular notch over here that's down and through there. So those are the two bones that make up that shoulder girdle, and that humerus, this first bone of your upper arm here, this bone here, is what comes in contact with that scapula. Zoom it in a little bit so we can see. The head of the humerus is what comes in contact with that scapula. So we have this head of the humerus here coming in contact with this glenoid cavity. Our humerus has an anatomical neck that is just past the head. So here's that anatomical neck. We have, that is different, a surgical neck. The humerus has a surgical neck because this area right here on the humerus is the most commonly broken part of the humerus, of this specific bone. This is the area that's most commonly broken. So, for that reason, it was given a name. Some other things we have. We have a greater tubercle and a lesser tubercle. That greater tubercle is that larger bump. That lesser tubercle is that smaller bump. Between the two bumps, there we go, we have the intertubercular sulcus. Inter, between, tubercle or tubercular, in between the tubercles, there's a sulcus. There's a little divot down in here. So this little divot through here, it goes the entire length of between those two tubercles. It even goes a little bit further down. That is that intertubercular sulcus. So if we travel about halfway down this humerus, we have this little roughened up area. Again, something connects here, so it's given a name. Here we are looking at this deltoid tuberosity. This is just a roughened up area on the bone where that deltoid muscle, the muscle at the top of your shoulder, attaches to that humerus. You kind of feel down the middle of your arm. You should be able to feel where that deltoid comes down to that bone. You can feel a little divot almost in there. That is right where that deltoid tuberosity is found. If we travel down to the bottom of the humerus, there, at the bottom, we have a coronoid fossa. So on the scapula, you have a coracoid. On the humerus, you have a coronoid fossa. We have a medial epicondyle. Epi means above, condyle, so we're looking at this area above the condyle, so right here. We also have a lateral epicondyle. Again, epi above, and it's on the lateral side. So how do we tell medial from lateral on the humerus? Well, the head of the humerus is on that medial side. It faces your trunk. So on the same side that you see that head of that humerus here, you follow it down, that same side is going to be that medial epicondyle. So that medial epicondyle is always going to be on the same side of the humerus as the head is. Okay, our next, the trochlea. I was looking at your list. You don't technically need the coronoid fossa. You do need the trochlea. The trochlea here is this area through here. That trochlea is what this next bone down, this ulna here, helps to attach itself to the humerus on this trochlea. This is what helps us to bend and straighten our arm. There we go. Is this ulna gliding back and forth on that trochlea. Now if we look at the back side of the humerus, this first picture here is the front. The second picture is the back of the humerus. We have this olecranon fossa. That is this area at the bottom of that humerus. On this ulna, there's this little hook like process that comes up and around. That hook is that olecranon on that ulna. We'll look at it again in a picture that's closer up of the ulna, but I wanted to kind of say that hook of that olecranon is what goes into this olecranon fossa. And that's what actually causes your arm to stop. When you go to straighten your arm, that's why you can only straighten it as far as you can, because that ulna is going into the olecranon fossa and stopping. It's kind of catching to prevent you from your arm from bending backwards. Something to think about. So here, if we come down to the radius and the ulna. The radius and the ulna here are the two bones that make up your forearm. The radius is always going to be on your thumb side. The ulna is going to be on your pinky side. To help you kind of figure out which side is which, that radius is always going to be on that thumb side. The ulna is going to be on that little finger, fifth finger, pinky side. So if we're looking at, let's look at the radius first, because there's not as much on the radius as there is on the ulna. Our radius has a head. The head of that radius is flat and circular. This flat circular head, I don't know why I just colored it in, but that flat circular head is what comes in contact with that humerus and kind of glides along that bottom portion of that humerus. We have this radial tuberosity. Tuberosity is that bump. This is what helps this radius kind of attach at the top part to that ulna, the bone next to it. Kind of keep them both in place. At the bottom of the radius, we have this styloid process. You can feel this in your wrist. It's this little point down at the end of your radius. So on that thumb side, kind of follow that bone down. You'll feel this kind of little bump that goes out. That is where that styloid process of that radius sits. Now let's go to the ulna. I'm going to pull up, kind of bring it to the middle so you can see both sides. Again, that olecranon is that hook at the top of that ulna. We have, can't see it from any of these pictures. I'll find it in the next one. We also have a styloid process of the ulna. This is a smaller point. You can see it in the back here, this point that comes down on this side. So if you want to feel down on your pinky side, you can kind of feel where the bottom of that ulna sits. So if we look at it from the side, here's another view. I want it, because this way you can see, here is this olecranon, that trochlea that we pointed out on the humerus. On the ulna side, we have the inside of this hook. That is known as the trochlear notch. Here you can see a really good view of that radial tuberosity here. You see the head of that radius. So here you can see the olecranon on that outside. So here's that olecranon out here. That's the point of your elbow, is that olecranon. If you bend your elbow, that point at the end, that's the olecranon. Then we have that trochlear notch that is found on the inside, because that's what comes in contact with that trochlea. And then on that radius and that ulna, we have the styloid process of each bone. Your wrists. There are 8 bones, I know I've mentioned it before, that make up your wrists. You do need to know all 8 bones. There are some mnemonics. Here's one: stop letting those people touch the cadaver's hands, like scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Those don't work for me. At least this mnemonic doesn't work. If there's mnemonics that work or stick for me, I'll tell you. This one doesn't, just because there's 3 different bones that start with the letter T. I learned them memorizing the bottom row, memorizing the top row, just memorizing them in order. For me, that's what worked. Of course, you got to find what works best for you. Let's go through these. We have the scaphoid. This scaphoid here, it's a kind of a larger bone here. This is one of the more commonly broken carpal bones. When you fall with your hands stretched out in front of you to catch yourself, this is the bone that, if you break a bone, this is the one that'll break in that when you go to do that. It's natural instinct to put your hands out, but that's bone that usually gets broken when that happens. The next bone is the lunate. This lunate is this second bone that I am outlining in blue. Technically, the next bone is the triquetrum. The triquetrum sits underneath but next to that lunate. The pisiform sits on top of the lunate. Or not lunate, triquetrum, sorry. So that pisiform, this is if you're looking at it from the palm of your hand. That pisiform is on that thumb side, that first row. You can usually feel that pisiform is pretty close to that crease in your wrist. It sticks up. It's that bone that kind of sticks up. It sits on top of the triquetrum. We go to the next row. We have the hamate. That hamate here, this bone here, this bone also has a little hook on it that comes up. It's known as the hook of the hamate. In a picture, it's a lot harder to imagine. But if you were looking at an actual hand, this is a bone that has the little carpal bone that has a hook on it. Our next bone is going to be the capitate. This capitate is just that next one in that row. Then we get trapezoid and then trapezium. I told you, the two names very close together. And I'll just use this one again for that. Trapezium on that thumb side. So however you want to learn these, whatever works best for you, I learned them scaphoid, lunate, triquetrum, pisiform on top. Hamate, capitate, trapezoid, trapezium. That's how I learned them. That's what works for me. The other picture shows them from the back. So if you're looking at the back of your hand, those bones from the back. You don't really see that pisiform very well, or you don't see it at all if you're looking at the back of the hand. You can only see that pisiform if you're looking at from the palm of your hand side. Our next group of bones are these metacarpals. The metacarpals, they're labeled 1 through 5. Your thumb is the first. Your pinky, that little finger, is the 5th. But these are the bones that make up the palm of your hand, are these metacarpals. And then your fingers are known as phalanges. Fingers and toes are phalanges. These phalanges here, figure out what I'm doing. There we go. Your thumb only has a proximal and a distal phalanx. Fingers 2 through 5 are going to have a proximal, a middle, and a distal phalanx. If you think about it, your thumb only has that one place that it bends. So it pretty much just bends in half. Each of your fingers have those two places that they bend, those two joints, as they're known as. So that's why there's a proximal, middle, and a distal for your fingers. Your thumb has that proximal and distal only. So here's that mnemonic. If this works for you, Google has lots of other mnemonics. You can find different mnemonics for the different carpal bones. If you just Google mnemonics, carpal bones or carpals, and I'm sure you'll come up with quite a few. There's a lot of mnemonics out there if those work well for you, or just memorizing them in order. That's another way to do it. That's just for me, that's what worked. So let's look at our pelvis now. Our pelvic girdle is what attaches our legs to our trunk. So our pelvis is made up of 2 hip bones, and then our sacrum and coccyx are kind of found in the middle in the back. So if we go to the front here, we have this pubic symphysis. This is this area in the front here that is holding the 2 bones together in the front. We have our obturator foramen. That is this opening through here. There's a muscle that travels through there known as the obturator. Again, name matches that obturator foramen. You don't need to know that muscle, but you do need to know that obturator foramen. That acetabulum. This is this area through here. That is where your leg attaches to your pelvis, is in this acetabulum. So let's come down and look at one of these bones. If we break it apart, your pelvic bone here is made up of 3 separate bones that fuse together during growth. When you were an infant, these are 3 separate bones at the time, held together through hyaline cartilage. But these different bones, we have the ilium at the top. The ischium is on the back side. The pubis is in the front. That's where that pubic symphysis, so that pubis has to be at that front. The iliac crest. The iliac crest is the portion across the top. It's just that the top rim of your pelvic bone. In the front, we have this anterior superior iliac spine and anterior inferior iliac spine. So what we're looking at is this point here and this point here. The one up on top is just that anterior superior. The one on the bottom is that anterior inferior. Again, we're looking at that acetabulum. This is where your leg bone, the head of that leg bone, which is your femur, comes in contact with that pelvic bone. So we come to the back. We have this greater sciatic notch. That big, large indentation through here. Then we go into that ischial spine, which is this point that greater sciatic notch comes down and points into. Then we go into that lesser sciatic notch. The lesser sciatic notch is just this really small portion through here. Your ischial tuberosities, those are your sit bones. That's what you sit on. Is that ischial tuberosity? That's where your hamstrings are actually going to attach to that ischial tuberosity. Again, that's where that name comes from. We have the pubic tubercle. This pubic tubercle is this point. This is by that pubic symphysis, which you can only see in the pelvis that is fully put together. Here we are from the back. We still have that ilium, ischium, pubis. Just another angle that we're looking at that obturator foramen, that large opening, that lesser sciatic notch, ischial spine, greater sciatic notch. iliac crest along the top, anterior superior iliac spine, anterior inferior iliac spine. You see that pubic tubercle? You can see where this pubic symphysis is. Comes together in here. You have that ischial tuberosity, which is that sit bone along the bottom. And this is what you need to know off of this bone. You don't need to know the rest of this information. If you're going on to a graduate anatomy class, you would, but for here, this is all you need to know. So our pelvis. Here again is that pubic symphysis, which is this area through here. Our pelvis, there is differences between a male pelvis and a female pelvis. A male pelvis, if we look over on the right-hand side, has a pubic arch that is very narrow. It is less than that 90 degrees. A female pelvis, this pubic arch is a lot larger. It's because a female pelvis is designed to birth a baby. So it has to have that opening to allow for that fetus or baby to fit through. You can see some other differences, but the main easiest way to tell is looking at that pubic arch. You can see the pelvic outlet, see how the female pelvis is a lot larger, just that opening from the top to the bottom. There's a lot of differences, like just size differences. So let's move on to our femur. Our femur is that thigh bone that attaches to this hip bone or your pelvis. Your femur has that head. That head is that area that fits into that acetabulum. Just past the head is the neck. So this area through here is going to be our neck. We've talked about tubercles. We've talked about tuberosities. Here's our trochanters. We have a greater trochanter and a lesser trochanter. So our greater trochanter is this very large projection on the outside. Our lesser trochanter is this point on the inside here. On the femur. If we are looking at the front of the femur, we have the intertrochanteric line. That intertrochanteric line is this area through here. We have the intertrochanteric crest on that back side, which is through here. There's a little bit of drop off there. That's on the back. This one is on the front. On the back of the femur, we have this linea aspera. This linea aspera is kind of this line that travels along the back of this femur and several muscles attached there, so it's going to have a name. Coming down to the bottom of the femurs. Femur. We're looking at the front and the back. That's where they asking from, sorry. Okay. On the same side is the head of the femur. We're going to have the medial epicondyle and the medial condyle. So if we see here, the epicondyles on the side, this condyle, you see it better from the back, is kind of that under part that comes in contact with the next bone down, which is that tibia. We have a lateral epicondyle and a lateral condyle. That lateral epicondyle is on the opposite side as the head of the femur. Those lateral condyles are along that bottom. Just want to make sure I hit everything on there. There is one thing I do not have a, there it is. So on the head of the femur is where we're going to find this fovea. It's listed on your sheet as fovea capitis. Fovea capitis. The fovea capitis is this indentation in the head of the femur. This indentation in the head of that femur, there's a ligament, as this says right here, that travels through there to help hold that head of that femur into that acetabulum. Here you can see really well that intertrochanteric crest. So you see that drop off through here. That kind of comes down. And then we see that lesser trochanter, this projection here. Just another view of that medial epicondyle, medial condyle, lateral epicondyle. On the front of the femur, I'm just pointing it out so you can kind of see there's this large smooth area. This is where that patella, your kneecap, is going to come in contact with that femur. So here's that patella. All you need to know, whoops, is this is a patella. You don't have to tell me anything else about the patella except that this is a patella. I take that back. That was my bad. The base of the patella is the top. The apex of the patella is the bottom. Remembering that because that'll come in handy again in anatomy too. The base of the heart is the top, the apex of the heart is the bottom. So you're going to hear that come back. That's why it's mentioned. We have the tibia and the fibula. The tibia is the medial bone. Tibia is medial. The tibia is going to have a medial condyle and a lateral condyle. So that medial side, that lateral side. On the front of the tibia, we have a roughened up area that is known as the tibial tuberosity. You may even be able to feel that on the front of your leg. That kind of bump, that large bump on the front below your knee, that is actually where the tendon for all your quadricep muscles, the muscles on the front of your leg, come down and attach. It comes down and attaches to that tibial tuberosity. On our tibia, we have a medial malleolus. This is this bump here. This is your medial ankle bone. So your ankle bone in the middle is known as the medial malleolus. Fibula. The fibula, this mnemonic for tibia and fibula down here, the location of the tibia and the fibula. The fibula is lateral. So this fibula here is the lateral side of the bone. This bone does not carry any weight. It has muscles that attach to it, but there's no actual weight that this fibula is carrying. We have the head of the fibula at the top, and then at the bottom, we have this lateral malleolus. So that's your ankle bone on the outside of your leg. That lateral ankle bone on the outside is that lateral malleolus. At the bottom of the tibia, we have this fibular notch. That is this kind of impression in here. This is where that fibula is going to sit against that tibia at the bottom. And then here again is that medial malleolus at that bottom. Now to our foot bones that are also known as our tarsal. Remember, your wrists are carpal with a C. Your ankle bones are tarsal with a T. So the one that the tibia comes in contact with is the talus. That is this top bone right here. The next bone is the calcaneus. The calcaneus is the bone at the bottom. So it comes through here. This is the bone that makes up your heel, the specific heel of your foot. That is the calcaneus. You can see it on the underside really well, this calcaneus over here. In front of the talus, we have the navicular bone. So this navicular bone through here. Then we have three bones that have the same name, just labeled first, second, and third. So we have first cuneiform, second cuneiform, and third cuneiform. So that first cuneiform lines up with that first toe, that second cuneiform with the second toe, the third cuneiform with the third toe. And the last bone here is the cuboid. The cuboid comes in contact with the fourth and fifth toe. To me, the foot bones, the tarsals, were a lot easier to learn than the carpals because every bone looks different, minus that first, second, third cuneiform, but they are literally lining up with their specific toe. When I ask the carpal bones or the tarsal bones, they will be attached to a foot. So you'll see the entire foot when I ask you what bone is what. I am not going to throw the second cuneiform at you and say, what bone is this? Not at this level. Okay, your next group of bones are the metatarsals. Just like the palm of your hand are carpals or metacarpals, the rest of the bones that make up the rest of your foot are the metacarpals. And again, they are labeled 1 through 5. 1 is the big toe, 2, 3, 4, then 5 is that little toe. And just like your fingers are phalanges, your toes are phalanges. Your big toe has a proximal and a distal phalanx or phalange. Your second through fifth toe has a proximal, middle, and distal phalange. Our foot is made up of several different arches. There's different tendons that follow along these different arches. We've got this medial arch, we have this lateral arch, and then we have a transverse arch across our foot. This goes into if you want to start working with physical therapy. They'll go into this a lot more if you want to start working with podiatry. You'll learn a lot more of this there. So then the rest of this PowerPoint, as it says, there's 109 slides here, and I've only been through 29 of them. The rest of these go through the pictures of these bones. Again, you see some of it labeled. It'll go through and label everything for you, break everything down. What part is what? These will be the pictures that I use for the lab practical. So if you want to print these out, cut them apart, keep the lines there. So then when I used to do these, that's what I used to do is I used to print this stuff off, cut the lines out. and then tape it to a flashcard and draw the line and number them all. And then on the back, I had the numbers and what they all were. These are ways to work through this. I've had students buy actual like anatomy flashcards off of Amazon because it was a lot time saving. Highlight or circle just the ones that they need to know and learn them that way. There's a lot of ways you can go through and do this, whatever works best for you. But your brain does work through that constant repetition. So take the time to go through this, work on it. Just going through the PowerPoint a few times is not going to learn this because you're going to need to be able to recall. You're going to be able to need to look at a picture of something and say, oh, that's the lesser tubercle, or, oh, that's the head of the humerus. So you're going to need to be able to spew it right back out. There's not going to be a multiple choice to help try to jog your memory. These are all fill in the blank, just like the last practical was. If you have any questions on anything, let me know. Otherwise, thank you very much for listening.